Hi, my name is Beatrice Santos. So, over 20 years ago, my parents immigrated from the Philippines to America. And on my dad's side, unfortunately, his parents have passed away. So, my grandparents on his side and my grandparents on my mother's side are alive in the Philippines, but they are not doing well. They're very sick. And so, earlier this year, from March to June, my mom took time off of both of her jobs to spend time with them and take care of them. And she is a full-time lab technician and a part-time caregiver. And she needed someone to replace the days that she wasn't there for caregiving. And so she asked me to do this. And I know you're not really supposed to say this kind of thing, but I just have never had it in me to have a lot of compassion or a big heart for older adults. And so this sounded like a really challenging task when she asked me, and I wasn't enthusiastic about it at first, but that completely changed. The woman that I got to work with, her name was June, and she is just so sweet and kind, and I loved working with her. It taught me a lot about compassion and just about teaching and caring for older adults, which is something that I didn't have a lot of experience with. And it turns out actually, so she lives in my hometown. It turns out that she is the grandmother of my 7th grade English teacher. So we did have a connection there, which was really interesting and sweet. So I was just thankful that I got this opportunity to care for her before going into nursing school and working with older adults in the hospital. So yeah. Something that I learned, we learned together and wanted to focus on really was fall risk and constipation. These both were side effects from the medication she was taking, and also that in combination with her being 95 years old. She does take 15 medications, which is a lot, and obviously these medications have changed over her 95 years of living. And so just to have a list of updated side effects and what the medication does. Part of being a caregiver, in my experience, is administering medication, and almost all of her medication was oral. Some of it was topical, but no injections or anything like that. So her medical conditions or some of the history that she has, it varies a lot from hypertension to glaucoma to diverticulitis and just various conditions in the realm of older adults that she was dealing with, that she was medicated for. So going over what each medication does and its side effects was important because she has so many medications, she doesn't take them herself, and so it kind of empowers her to have that knowledge and to know if something's going on, that it could be a potential side effect and that it's normal. And then dealing with fall risk and constipation, she has a caregiver from 9 a.m. to 7 p.m. So there is a gap of time where she is not supervised or with an adult, I should say. And so coming up with some solutions and preventative measures was obviously very important to us, and just making sure that she was taking her medication in the best way possible at the right time and with the right supplements and all that kind of thing. So we addressed these issues and came up with solutions together that she was able to implement. And I was really fortunate because she was appreciative of the information that I shared with her. She was very open-minded to make some of the changes that I suggested and implement different things into her lifestyle, which was very kind of her to even give me the time of day to speak to her about this. So that it was just really awesome that she wanted to learn and she wanted to have this knowledge about her medication. Something that I learned was a little bit about her medical history. So as a caregiver, a lot of my role was to fix her bed and make food and help her with everyday living, basically. And I didn't know a lot about her medical history because I was thrown into this position a little bit. So it was really interesting to see some pieces be put together. And also just caring for older adults, like I mentioned earlier, I have a whole new compassion for older adults because of my experience with her, how it was so positive. And also the whole home healthcare, rather. It's something that I didn't know a lot about before, and something that I learned a lot about with my work with her, and something that we don't really have a lot of experience with so far with nursing school and time in the hospital. So being able to gather information and present it to a client or patient and kind of work with them collaboratively to come up with a solution or really just inform them is a process that I know that I will be taking with me in the future. So yes, thank you for watching.